From the videos, looked like things were quite stable, but again, what we've learned with COVID is, sometimes course can change, and again, it's going to be one day at a time.
President Trump updated the public on how he's feeling via Twitter videos all weekend. The White House says the 74-year-old tested positive for coronavirus early Friday morning.
I came here, wasn't feeling so well. I feel much better now. We're working hard to get me all the way back. I have to be back.
If there's one thing we've learned about the coronavirus this year, it's that it's unpredictable.
Certainly when it comes to COVID, there's no standard trajectory. We've seen very mild illness. We've seen patients that start out mild and then progress, unfortunately.
Still, the president remains optimistic about his health on Twitter.
We're getting great reports from the doctors. This is an incredible hospital, Walter Reed.
He's been given 3 treatments so far. First, an antibody treatment, which are designed to attack the virus early on. After he was admitted to Walter Reed Medical Center, he was given an antiviral medicine called remdesivir.
Both of those medications are most effective when given early, and I think that was the general goal of the president's treatment team. And then the other medication that he's received is dexamethasone, and that's what we call a corticosteroid, which basically blocks the inflammatory process associated with COVID-19.
Dr. Banach says knowing the president was on dexamethasone gives some insight into his condition, because that medicine is reserved for patients when their oxygen levels drop.
And then it subsequently was presented in some of the press briefings that he did have periods in which his oxygen level was low and he required supplemental oxygen. And that's really a criteria that we use in the hospital when we make a decision to give dexamethasone.
Dr. Banach says that patients often start to feel better after the initial onset of symptoms, but it doesn't mean that Trump is out of the woods yet. He says his team of doctors is going to have to keep a very close eye on him as the disease progresses into the next phase, which can often cause your lungs to be inflamed. Taylor DiCello, Fox 61 News.